Hello. Today we're going to talk about low back pain in children as schoolgoers and how to prevent that. There is high prevalence of low back pain in children and in adolescents, and it's attributed to factors like lifestyle, as in less of activity, diet. There are factors which are related to school. There are factors which are physical, and most important is psychosocial or psychosomatic factors, wherein we usually think that children are complaining of pain because of some other reasons, maybe peer pressure, maybe some problems in school, some fight with other children. These are the reasons why they do feel pains like abdominal pain, little bit of headache or back pain as well. But nowadays there are substantial literatures which are proving that though these pains, which are not so well enumerated by children, because they are not a very long staying pain, they are short-lived pain but they come recurrently, we as parents do not put so much emphasis on them. But it is seen that children ranging from 11 to 12 years to as long as 18 or even 19 years do have pains, and any pain in that matter is something that we should worry about, because the structure that's taking the pain weakens through the course of years that the child is taking the pain into. These literatures have also given us proof that these kind of pains that children develop during school hours or in school years is the most important predisposing factor for adults having pain in future. So all the more it's important for us as parents to look into the fact how to prevent these things so that our kids do not grow up to have pain syndromes. The most important thing that we can do is called postural hygiene maintenance through education, which means we explain to our children how to sit. It's very important that we should tell them that they should not be sitting on the bed, which is a very, very common thing in the Indian household. They sit on bed and study, which is not the right place because the bed does not provide a firm base. So we should allow our children, or encourage them in fact, to sit on chairs which are a little hard on. They should have their low back supported and not upper back. So they don't sit like this, but they sit like this. And their back should make a right angle to their hip, and the angles should be maintained throughout. So even the knees should be at a right angle to your legs, legs at a right angle to the ankle. Sometimes the chairs that we have in our household may not be at the proper height, so you will have to encourage the child to put some kind of platform underneath and put their legs onto it. Very important are these factors. Second thing is always ensure that the desk that the child is working on should be very close to the chest. The further away the child seems to dangle onto the chair, and then they start to develop this kind of back pain. Neck pain is again a very common thing in children as well. Second thing, and the most important thing, is the school bag. So the recommendation is 10 to 15% of body weight should be the weight of our school bags. So please ensure, nowadays I have gone through things where the schools are trying to incorporate ways like lockers for the children so that they don't carry the weight. Now if these things are not there, if these facilities are not there, please ensure that you teach your child how to pack the bag best. One, all the things should be firmly kept inside. They shouldn't be dangling and loitering inside the bag. And the height of the books should be at an ascending order. So the smaller one in the beginning and the end should be the big ones. And all the bags containing other small articles like maybe a pencil box should be nicely packed so that the bag is firm enough. This allows the bag to have a distribution of weight. And second and most important thing in school bag is to keep the bag up to the level of your back and not dangling. This is something that we always see. Kids keep the strap very loose and they keep it dangling at their buttocks. That's not right. They should fasten it with a chest belt and a hip belt, which is provided with most of the bags. So they should be nicely coupled to the body so that the bag doesn't take the dangling weight. And the third and most important thing to prevent is to be able to allow our children to work 60 minutes every day. So any kind of physical activity, 60 minutes is enough throughout the day. So we can incorporate few exercises which they can do in between classes. because it's between this 1 hour of class that they are not so much concerned about how they are sitting, and it's not possible because they're probably concentrating on the class. So please encourage them to do exercises in between classes, and if it's not possible, they should come back home and do exercises. The simple exercises can be the neck, which I think last video we did discuss, which was neck held straight first and then going up, coming back, going down, looking to all possible ways that the neck can actually venture into. Shoulder exercises like shoulder up, down, shoulder squeezed at the back and relaxing, and back exercise like pulling the abs in. So just tighten the abs, keep it for some time. When we tighten the abs, as I'm doing, I'm also actually pressing my back to the chair support. So that allows for the back pain. Prevent it, and then again allow it, and then again prevent it. So gradually we are actually contracting the abs and relaxing the abs. And the most important is to tilt, which is just curl and come back. Again curl and come back. So if these exercises are done maybe a couple of times throughout the day, then mostly what we can prevent is the back that may lead to lot of problems in future. So in order to take our children off this pain syndrome, it's very important that first we educate ourselves and then educate our children. Wish you best.